Hi, good morning everybody. I'm here to talk about the evolution of impact practices at Quadria Capital. Over the last decade, Quadria Capital and our portfolio companies have worked very hard to bring high quality, affordable healthcare services to those most vulnerable. We see ourselves as drivers of positive change. Throughout our journey, we have continuously sought to improve our impact framework by harmonizing the global best practices and standards. Our impact strategy is anchored on the United Nations Sustainable Development Goals, and investments are directed at addressing some of the most pressing social and environmental challenges. Some of the impact highlights that I'd like to highlight over here. Over the last 10 years, we've been able to touch over 230 million lives with the help of innovative and specialized products, conducted over 26 million diagnostic tests annually, and supplied over 20,000 generic drugs to our customers. But here's the thing, we're always eager to learn and adapt to new emerging impact practices and trends. Thus, we launched our proprietary impact framework in 2022. This supports a more nuanced and measurable delivery of our ESG and impact commitments. Keeping our legacy impact circle as the core foundation, our impact management refresh project led us to incorporate several nuanced features and industry practices. So our framework will help us to do two things: have to identify companies which have help us to drive profit, and second, measurable benefits for our society. And the larger goal would be, our ambition would be to impact over 1 billion lives by 2030. Getting more granular in our framework helps to answer three most important questions for us. How can we ensure that we select the right impact companies? This we are doing by applying an impact screen early on in the process, so that we make sure that investments meet the baseline impact criteria before we proceed ahead with any diligence. Second, how do we ensure that an investment will drive impact? For that, we have our impact scorecards and our thresholds defined. Only once any investment meets the thresholds is when we decide to take it further to the next stage of evaluation. And third, how do we measure impact in a consistent manner? This is done by looking at metrics and impact thesis and looking at the 5 dimensions, which is what is the impact that we are trying to create, who is the problem trying to, who is the impact created for, how much is the impact, the risk related to the impact, and the contribution that Quadria has been able to make through this investment. Our new framework has a 3-tiered ESG and impact approach. One is the impact thesis, the tier 1, and the 5 dimensions which underpin our impact strategy. Second is the ABC investment approach to our investment goals. And third, where we look at the ESG evaluation process across the investment cycle. Here, I'd like to point out 2 cases of our most impactful companies, Hermina and MaxiVision, which will later be talking also in the panel discussion. Hermina is one of the largest hospital networks in Southeast Asia, and the impact strategy over here was hinged more on accessibility and affordability. They have over a set of 48 hospitals, touching over 7 million patients annually. Also, affordability, because they are serviced by the Universal Healthcare Program of Indonesia, and patients pay between 25 to 65% lesser than at any other private hospital. Quality also has a role to play with about 3 centers of excellence in existence currently. Second is MaxiVision. Here, it's one of the largest eye care chains in India, with over 40 plus centers in about 6 states in India. The impact thesis here was anchored more on accessibility and quality. They've been able to impact over 5 million patients so far, and they are expanding further into tier 2 and tier 3 market, with over 47% of the new centers coming up in these cities. Quality, they have all the accreditations. So that helps us to assess the scores that we are able to assign to these companies before we make an investment. This slide particularly just illustrates how a scorecard works for us. We have a set of KPIs across the four pillars of accessibility, affordability, quality, and awareness, which are scored on a scale of 1 to 5. By virtue of this scorecard, an assessment of each portfolio company is done at the time of investment to arrive at an actual score at the time of investment and an anticipated score at the time of exit. Lastly, I'd also like to highlight that apart from SDG 3, which is the core focus area for us at Quadria, we're also working very hard on SDG 5 and SDG 3 as our impact commitments. For SDG 5, our focus is on leading the change by being committed to building a more gender diverse workforce, both at the fund level and across our portfolio companies. And second, on climate commitment. We recognize that delivering quality healthcare and addressing climate change cannot work in a compartmentalized lens. We look at climate risks at the time of diligence, and we're also looking at management of emerging opportunities that arise from climate change, which will be important climate-proof our assets in the future. With that, I'd like to bring up the impact video, which demonstrates how we're collaborating with our companies to drive meaningful social impact.
At Quadria Capital, we believe that access to healthcare is a fundamental human right. We believe in the power of private capital with a mission to reach millions of the most vulnerable whilst not compromising financial returns.
We are focused on bringing private capital to meet the acute need for quality, accessible, and equitable healthcare in Asia. Populations across this region continue to grow. Many countries have ambitions to modernize and foster healthy, prosperous, middle and high-income societies. It is a vibrant and rapidly developing region full of investment opportunities. However, rapid growth comes with challenges, especially for societies where infrastructure and governance are also developing simultaneously.
Population growth, poverty, and prevalent chronic diseases have strained regional healthcare systems. Asia has the highest prevalence of chronic diseases as well as the largest number of patients with diabetes, cancer, and cardiovascular diseases globally. Almost 400 million people in Asia live in extreme poverty, and the pandemic has pushed another 80 million people into further extreme poverty. Many people still face barriers preventing them from accessing the care they need and deserve. An estimated 1.6 billion people in Asia and the Pacific lack effective access to social health protection.
We are acting on this challenge and the opportunity it presents, empowering and partnering leading healthcare businesses and entrepreneurs to meet the surging demand for quality, affordable healthcare across the Asia region, whilst at the same time driving exceptional returns for our investors. Since our founding 10 years ago, we have backed 28 successful healthcare businesses in Asia. With our support, they have opened and expanded hospitals and clinics. They have expanded production of affordable generic drugs and made them more widely available to underserved populations. Together, they have served over 230 million people across South and Southeast Asia.
We are proud of the progress we've made, both in terms of the returns we have delivered and the deep social impact that has been created through our investments.
We have been particularly focused on formalizing our proprietary impact framework, the Impact Circle, and applying it to our existing and new investments to help us to drive and measure impact. Organized around 4 dimensions: will this investment make healthcare accessible? Will it make it more affordable? Will it increase the quality of healthcare? And will it raise awareness of healthcare solutions? We have successfully deployed this framework to help us assess new opportunities as well as to understand the impact that we have made with our past investments.
A recent investment in Indian eye care chain Maxivision and divestment from Vietnam's FV Hospital are great examples of this approach in action. At Maxivision, India's leading eye care provider, the Impact Circle demonstrated the synergies between our approaches and the value that we could bring. We could see how our capital would enable both organic expansion and accelerate inorganic partnerships to help bring high quality eye care to more patients across more regions in India where medical services are lacking, driving access. Maxivision's model is built on providing affordable and quality eye care to over 5 million patients across 42 centers in India.
At Maxivision, our mission is to scale and serve the growing demand for eye care in the country, particularly in Tier 2 and Tier 3 cities that remains underserved by the Indian eye care market. Our business has evolved tremendously over the past few years, and today we are proud to be one of the most trusted providers of eye care, particularly in South and West India.
Similarly, when we apply the framework to FV Hospital, which we successfully exited earlier this year, we're able to track how we have made a difference. We supported FV to enhance access, increasing patient volumes by 20% and the number of doctors by 25%. We helped improve the quality of care with state-of-the-art diagnostic equipment, enabling access to the most advanced treatment plans. FV received JCI accreditation for the third time in 2022.
FV is what it is thanks to a team of talented professionals who work together for many years. Executives, middle managers, doctors and their entire staff. I'm very proud of them.
At Hermina, on the other hand, which is one of the largest hospital networks in Southeast Asia, Quadria is playing an active role in supporting Hermina's plan to develop its centers of excellence. Hermina is serving over 7 million patients every year across 45 hospitals, with over 60% patients covered under the government's Universal Healthcare Program.
In the last year, we embarked on the journey to enhance our impact framework. This was done to support a more nuanced and measurable delivery of our impact commitments and aligned it with the UN Sustainability Goals and other leading industry benchmarks. Our refined framework further strengthens our ability to identify and execute deals that will expand quality healthcare across Asia while continuing to deliver excellent financial returns to our investors.
At Quadria Capital, we are for changing healthcare, investing in companies that are addressing the changing healthcare needs of patients, communities, and society, and using our capital to improve treatment options and change healthcare outcomes for the better for all patients.
We were founded on the basic principle that responsible and sustainable investing drives both social and financial impact, and this remains central to our approach today.